There are 4 main risk factors for COVID: person, time, place, and space. Person refers to how many people you're interacting with. Time refers to how much time you're spending with those people. Place refers to whether or not you're indoors versus outside. And space refers to how much distance you have to spread away from other people. The 4 key prevention strategies are the 4 W's. Wash your hands, wear a mask, wait 6 feet apart, and wellness, only going out when you're feeling well. So one really important consideration when you're getting tested is that testing is not a prevention strategy, it's an early detection and isolation strategy. So a positive test today does not exclude the possibility that you could be incubating the virus. The virus can incubate for up to 14 days before you become infected, and you may not test positive during that time. One analogy people have used to help understand this is similar to a pregnancy test. That taking a pregnancy test too soon doesn't necessarily mean that you aren't going to become pregnant a week or 2 weeks later. So thinking about the principles of the risk factors and how to minimize those when you are considering different ways to socialize with your friends. If you're going to watch a movie indoors, you'll want to wear your mask. If it's warm enough or you have blankets and a campfire, you can consider watching movies outdoors. You can think about outdoor hikes, walks, bikes to take with your friends where you have the benefit of the outdoor open air and you can distance and wear your masks if the hiking trails or biking trails are crowded as well. If you do choose to have people over indoors, you want to think about activities that maybe don't center around food and drink as much, since that's a time when you would need to remove your mask. But think about having activities indoors with a smaller group of people over shorter amounts of time that might focus on a craft or doing something with your hands where you could keep your mask on for that time period. A way to make a safer indoor gathering would be to have fewer people, to have shorter amounts of time, and to physically distance when you're doing the activities indoors together. So for study groups, I would say first thing would be maybe to consider if in-person does offer a benefit over virtual studying, realizing that some of that can be done virtually. But if you do choose to study with others indoors, think about what space you have, can you physically distance, wearing a mask, limiting the amount of time and the number of people that you're with. Obviously, we know outdoors is much safer than an indoor space because there's more free airflow. If you're running outdoors, you could consider wearing a neck gaiter around your neck so that if you do find yourself on a crowded pathway where you can't physically distance from other people, you could quickly use the mask, the gaiter, and then return to running without a mask. So indoor dining is certainly not as safe as outdoor dining because you have a closed-in space. When you're eating and drinking, you're not able to keep your mask on, although certainly while you're sitting at the table and you're not actively eating and drinking, that's a great time to put your mask back on. Even if you test negative, you could still be incubating the virus, and so a negative test does not negate the need to do all the prevention strategies of wearing a mask, washing your hands, waiting 6 feet apart, and making sure that you're well when you go out. So eating outside is safer than eating inside at a restaurant. If you're outdoors eating, you're likely going to have to take off your mask in order to eat and drink. But when you are finished eating and drinking, that's a great time to put your mask back on. I think also when you're going to eat at restaurants, it's important to think about the spacing of the tables, making sure that you're choosing a place to eat that's as distant from other groups as possible, and also thinking about how many people you're choosing to eat with and for how long you're spending that amount of time with them. So it's important to remember that COVID testing is an early identification and isolation strategy. It's not a prevention strategy, so it does not negate the necessity of still doing the prevention strategies of wearing a mask, washing your hands, waiting 6 feet apart, and making sure you're well when you're around others. There's no absolutes here. There's no this is absolutely safe and this is absolutely unsafe, but it is important to understand the principles of what the risks are and what the prevention strategies are so you can think about what activities you are doing and make each one as safe as possible.